Now, if the licensing board went away, sure, providers, could provide care to anyone, anywhere. But the problem is, would they be fraudulent? Would they be trained individuals? We'd be looking at potential fraud and harm to the public, and also a potential, for low quality services to be provided.
Hello, and welcome to Disruptors at Work, an integrated care podcast. We're excited to discuss state licensing boards and requirements for clinical doctors of behavioral health. I'm Dr. U. Grant Baldwin, Jr., Director of the DBH program at Cummings Graduate Institute, host for today's episode. I'm joined by Dr. Cara English, CEO and CAO of Cummings Graduate Institute for Behavioral Health Studies. Today, our guest has an extensive background and expertise in health policy and advocacy, which sets the stage for our conversation. So let's get started. How you doing, right, Dr. English? How you doing?
I'm doing fine. Thanks for bringing this together today. It's a special topic podcast, isn't it?
Very special topic in the DBH field and culture. So very excited about getting these questions to you to get your insight and expertise. So
I thought maybe we could begin with a little bit of an intro, context, and background. We've had several questions that have been coming to me lately from the executive director for the Private School Association in the state where CGI is licensed, which is Arizona. And the questions to us have been about the sunset review in our legislative session of the existence of professional licensing boards. And in this case, the Arizona Board of Behavioral Health Examiners is under the review at this time. This is not the first time that legislators have asked to review licensing boards. And we understand that there are some concerns from members of the public who feel that there are too many licensing boards for certain professions.
Okay.
Normally what we hear from the public is that they understand why healthcare licensing is so important and so critical. But unfortunately, when they do a sunset review of licensing boards, all licensing boards are being considered as together. And so a few years back, we had some outreach in a similar way because there was a state legislator here in Arizona who was trying to abolish all state licensing boards without any type of replacement.
Abolish?
And so, yes.
Wow. Okay.
And so we provided, a strong statement of support for the continuation of state licensing boards, particularly in the health professions fields. But, licensing boards for things like hairstylists and tattoo artists are also under that same type of, all professional licensing boards. And so the ability to have safe public health procedures, across the board are often set as standards by those licensing boards. So for today's discussion, the reason that we put this, topic together was because yet again, the existence of licensing boards in the state and in many states now are under question.
Okay.
And so when the executive director reached out to me, I was happy that she did because I was able to provide her with, our support for the continued existence of health professionals licensing boards. So that would include any medical profession, including behavioral health and nursing and physician's assistants, obviously psychologists, all professional medical healthcare professions.
Okay.
But in specific, statements, I also thought that it would be a good idea for us to speak to some of the challenges that doctors of behavioral health face in terms of state licensing boards. So today's conversation is really a combination of all of those ideas.
Right. Now, I heard you mention about under review again. So why would it happen again?
Right. So as administrations change,
Okay.
And the shifting control of the legislators, Republican versus Democrat in state houses
Okay.
changes. And when the new, they call them, freshmen,
Hmm.
um, congressional members join, they often come in with strategies and bills that they have, been talking about throughout their campaigns, to their election campaigns. And there is a strong sentiment in Arizona and in many other states that, there's too much government interference.
Okay.
And
Hmm.
so part of the review comes from a person who lives in a rural area, and the sentiment in that rural area is that there's the licensing boards are interfering too much and being too prescriptive, or there's overreach. And so it's a strategy to reduce the licensing board's authority in the
Hmm.
state,
Wow.
and to reduce the amount of education and training or supervision that individuals would need to demonstrate in order to get that license or maintain that license.
Hmm.
And so, again, for the most part, people don't understand when they're voting. They often are given examples like, well, if you're a barber, you could learn that at home. You don't need to go to school, or, they might have an opinion about that. But what
Hmm.
they don't understand often is that often these efforts are across the board licensing boards. And so you have to be really careful about, what narratives you're listening to. Because there are predatory universities and there are
Okay.
predatory programs out there
Hmm.
who will enroll students without being able to meet standards and demonstrate that they have a connection to the person who has taken the course's ability to actually get a
Wow.
job.
Wow.
And so at CGI, our admissions process has prioritized individuals who have a master's degree at
Hmm.
the master's degree level for behavioral health, or as a nurse or a physician's assistant,
Hmm.
with a license to practice or are license eligible. We
Hmm.
have made exceptions for students who work in health policy, so public health, and in the insurance industry, those who are
Hmm.
executives, leaders, managers, who don't intend to do clinical practice as the
Okay.
outcome of their degree.
Right.
But for the most part, the reason that we require that master's degree with a license or license eligibility is so that if a DBH would like to practice clinically or supervise clinicians, that they will have the ability to do that at the master's level, because there isn't a doctor of behavioral health license
Right.
available in any state or territory. And so, that's one of the innovations that I shared with our executive director, that, there needs to be innovation in the type of license available,
Hmm.
that many people with a master's degree are now moving on to the doctoral degree. But it may be in a field such as a doctor of social work, so a DSW. It may
Hmm.
be in a PsyD or a PhD that's more of an academic setting, and they may face licensure issues.
Hmm.
And so I think it's important for licensure boards to be following the needs of both the public and the profession,
Right.
instead of being very punitive in their approach to, well, we're protecting the public in theory, but maybe we're creating overly prescriptive rules and regulations
Hmm.
that keep people who are not harmful, from being a licensed practitioner.
Wow. Yeah, I can definitely see how that can create some shortage of of
Right.
great people even entering the field with all
Mm-hmm.
that particular red
Mm-hmm.
tape. So I can definitely see that point. And you mentioned something real, and I kind of highlight this word when you say abolish. That kind of stood out
Mm-hmm.
to me. Um,
Mm-hmm.
I'm just trying to imagine in my mind what would happen if licensure boards were abolished And
Right.
what would that
So,
mean for like patients in general?
yes,
Yeah.
great question. So the largest patient protection standard would be gone. So right off the bat, we would see individuals who are in need of medical services, behavioral health services, having a delay in their ability to get care,
Hmm.
because we would see, so for example, when they were looking at abolishing all of the licensing boards, we were saying, so what would happen is we have, millions of state,
Mhm.
constituents who would be unable to get any kind of medical or social services for
Hmm.
a time,
Yeah.
because it would cause chaos and confusion about what is legally available and
Mhm.
who is legally allowed to deliver those services. You would start immediately to see predatory individuals and companies popping up like
Mhm.
mushrooms.
Mhm.
And that has happened in the Arizona environment because of a lack of funding for the health department, which resulted in a lack of oversight with substance abuse, sober living housing. So there was an enormous scandal in Arizona just a couple of years ago
Okay.
that uncovered tons of fraud where people were enrolling fake patients into sober living housing and
Wow.
then billing the state for the funding as if they were providing that care. And it
Mm.
was an enormous fraudulent scheme. So those go on even when there is, adequate licensing and oversight. And so what you would see is just that would go, that would grow
Yes,
like crazy
I can see that.
immediately.
Wow.
And then you would also see a lot of healthcare professionals who depend on their income, to go to clinic every day and see patients, probably making other choices. So
Mhm.
we have workforce challenges. We know that in the state of Arizona, through one effort and pretty much one effort alone to increase the workforce, we were able to see just in 1 year a significant increase in the number of behavioral health providers
Right.
who were trained and ready and able to meet the needs of the population. But we're still only at a 32% ability. So we are only able to meet 32% of the need of the entire state for behavioral health
Wow.
services.
Wow.
So that's still very small. And
Very
there are
small.
still a lot of people who, want services and cannot access them for a lot of reasons. So a licensing board that takes too long for a person who has gone through a master's degree program, completed all of their training, and is currently under supervision
Mhm.
should be able to see patients, but that's not always the case. Sometimes licensing boards will hold that up. And so that was one of the problems for a long time in Arizona. Arizona's Behavioral Health Licensing Examiners Board did make some important updates to the
Okay.
timeline. And so they did, make some important good changes, but at the same time, there are often rules about telehealth, for example. So telehealth has been one solution put forth since prior to the pandemic, but it became incredibly important during the pandemic to
Mhm.
be able to access services online. And a lot of licensing boards will say that you cannot provide services if I am a licensed provider in Arizona, that I cannot see a patient who lives in Texas
Mm.
or lives in another state. Even if the standards for a licensed individual in one state are exactly the same,
Same
or
test. Right.
same national exam,
Yeah.
same KCREP approved behavioral health
Mhm.
courses, same supervision requirement, etc. Um, because you're not licensed in that state, they will not allow you to do that, and so that also presents a barrier to the public. Now, if the licensing board went away, sure, providers, could provide care to anyone, anywhere. But the problem is, would they be fraudulent? Would they be trained individuals? We'd be looking at potential fraud and harm to the public, and also a potential, for low quality services to be provided.
Mhm.
And the other issue, of course, is that insurance companies only reimburse for certain provider types, and those
Correct.
are licensed individuals. And so
Mhm.
if there is no license, then it will be very hard for the public to get their insurance to pay for care
Right.
unless their insurance company very quickly responds to the change, and that's
Mhm.
unlikely. So there are a lot of issues here that aren't being talked about seriously enough, I think, for the
Mhm.
public. The level of health literacy about these issues is still quite low. Like I was just talking to a family member yesterday about some of these changes, and they said, "Oh, I didn't think that would affect me at all."
Wow.
And I said, "I know, and that's why we're having
Just having
this
this
talk."
conversation. Right.
But I just don't think that it's fair or equitable that, it takes a person with a doctoral degree and, 27 years of experience as a clinician and, health policy advocate, to understand these issues
Mhm.
completely, because the public are not being really informed about
Wow.
what's going on and how it will directly impact them.
Well, this is definitely one of the reasons why we're having this conversation. I'm being
Exactly.
enlightened about this as well.
Hmm.
And the next question I have, what are some of the changes doctors of behavioral health advocate for in terms of
Mm.
licensing requirements?
Yeah. So, first and foremost, I think most doctors of behavioral health would appreciate it if we do move towards a license at the
Hmm.
doctoral level for
Hmm.
doctors of behavioral health, whether or not they want to provide clinical services. And I think having the master's degree training, the foundational training in clinical care, is going to be important for those who want a clinical license.
Hmm.
But being able to bill at the doctoral level is critical for those of us who have gone through, just as much education and training as any psychologist, but we're being paid at the master's level because that is
Hmm.
the pay that the insurance companies have negotiated based on our level of licensure. So,
Hmm.
we are essentially at the doctoral level like a psychologist, but we're being paid at the master's degree level, like a master's degree in social work or counseling. And so that's a big change that we need to move forward with. We'd also really like to see an advance in the types of continuing education that are
Hmm.
required
Hmm.
for those with any type of license. Because the truth of the matter is, I got my master's degree in counseling in 2002. And the requirements for continuing education in terms of like how much continuing education I need, and the type of continuing education that I need, have not changed in the past over 20 years now.
Hmm.
But unfortunately, we can expect to see those be, even less than they are now because of this anti cultural competency movement that we're seeing with the new administration. And so right now, the requirements for behavioral health providers in most states are that they have a certain number of hours of continuing education in behavioral health. And then, in addition to that, that part of those hours be in legal and ethical requirements and in cultural competency. But there's no mention at
Hmm.
all about having any kind of training in integrated care, which
Right.
is an enormous need for behavioral health professionals, nationwide and internationally. There's no mention of a requirement to have training in trauma informed care, which has been the evidence-based standard in terms of care delivery for the past 30 years or more. We're definitely not seeing any advancements in the requirements of special populations. So, for example, understanding how to provide trauma informed and equitable care for those who are living with an intellectual or developmental disability, individuals from certain populations that have a much higher vulnerability and rates for mental health conditions or combined comorbid medical and mental health conditions. So we'd like to see advances in the types of continuing education that providers are being trained in, because someone who graduates today may have had better training in that, but they could be working alongside somebody who got their license 30 years ago and they've never had any training
Hmm.
in the same ability to deliver clinical services. So it's not equitable. It's not producing the best quality level of outcomes that we could be doing. So definitely grounding them in a foundational training and integrated care to start, and then, really looking at the population and
Mm-hmm.
saying we need to be prepared to deliver care to everyone in our population.
Right. I'll tell you what, you definitely, gave some great insight about, the need for advocacy for improved efficiency and license process for providers who
Mm-hmm.
have completed educational supervised practice requirements, and the
Mm-hmm.
need for a friendly attitude towards, providers from other states and territories,
Yes,
to
absolutely.
ensure
That's
that we
something we've got to.
build the workforce, the different, build the
Yes.
workforce with high
Mm-hmm.
quality providers. So I definitely, the need is there. The need
Yeah.
is there.
We've got to have public protections. That's
Hmm.
the bottom
Hmm.
line. We have to be able to protect the public because, at just back to the point about it shouldn't take a doctoral degree to know,
Right.
what type of provider you need, and, whether you go to this person versus that person if you're going to get the care that you need. We should be able to say this master's degree in social work is similar to this degree in, social work, and, we understand what that means from a
Hmm.
public perspective. But in addition to that, we do need to see advances in quality. We need to see advances in and innovations in integrated care, period.
Right. Absolutely. Absolutely. Thank you for sharing that. And this is very insightful for all DBHs and that are around the country in
Hmm.
different zones and internationally. So I thank you
Hmm.
today for giving us insight of the plight and the need for advocacy
Hmm.
um, in order to increase access.
Yeah.
It just only makes sense. It only makes sense.
Right. The big thing I think that a lot of providers don't understand because they've not had a lot of exposure to it, and
Hmm.
this is something I previously hadn't had a lot of exposure to, but the need to get involved in public health advocacy,
Hmm.
the need for, well-trained, well-qualified health providers to be involved
Hmm.
with the types of health policy that either are or are not protecting the public and ensuring high quality service delivery in their states.
Hmm.
Normally, the way that health providers are trained, um, we are not encouraged really to get involved unless it's with a professional organization. But,
Hmm.
from a behavioral health standpoint, even our professional organizations are not engaged in health policy, to the degree that they really should be. And doctors of behavioral health are a brand new type of professional, and our professional organization is still getting its training wheels on. And so, the need for individual doctors of behavioral health to get in touch with their, state public health department, their national public health department, and be advocating, raising their voice so that they are lifting up the voices of all of those who live in their neighborhood, all of those in their family, is absolutely critical. We can't allow others to continue to draw the strategy for us. We
Right.
have to be
We
the
have to be at the
leaders of
table.
that strategy. Yeah.
Right. Absolutely. And definitely, there's organizations that I know the Association of the Doctors of Behavioral Health, a newly formed organization, is, uh, out there and
Mm-hmm.
gathering and organizing DBHs
Mm-hmm.
from other institutions um, to bring folks at the table. There's a
Mm-hmm.
lot of people who agree
Mm-hmm.
of the need for this type of advocacy and being at the table. So
Mm-hmm.
thank you for giving us insight, even to to all DBHs everywhere,
Mm-hmm.
um, and the need for our organization. Period.
Yeah,
So mhm.
definitely. I think you should definitely put, maybe drop a link in the bio or in the episode notes about how people can get in touch with the new
Mhm.
Association of Doctors
Mhm.
of Behavioral Health,
Mhm.
because I know there are a lot of doctors of behavioral health out there who want a license, but they
Mhm.
don't know what to do. They don't know where to start in terms of getting involved or advocating for this.
Mhm.
And so just being aware, like, is your state looking at abolishing your behavioral health licensing
Yes.
board?
Yes.
Would be a great place to start. And then
Right.
getting in touch, with the Association of Doctors of Behavioral Health to see, how can I participate would be really important. So maybe you can put that information in the session notes.
Okay, thank you much. Thank you much. And on that note, I want to say thank you again, Dr. English, for being such an incredible guest and sharing your insight and expertise for today.
My pleasure. Thanks for putting this together.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.